So today we're going to give an update on where we are with COVID-19 and go through some of the data and talk about the measures that we're going to have coming up in the next few days and weeks. Where we are today should be no surprise to most people. We're in a reasonably good place. Since I last provided an update in March, we have continued to see progress that is in the right direction. Transmission, hospitalizations, and deaths are all down since our last report, and this is encouraging. Our approach has always been to only have the minimum necessary restrictions to keep our communities safe, and now we're at a time where we can progress from legally enforceable community requirements to a place of collective being able to manage this together. We are transitioning from having all of our safety levels all of the time to requiring some of them, depending on the situation that we're in, depending on our risk at each time. As we've seen in the last little while, hospitalizations and deaths in British Columbia continue to decline. We know that the cases in green in this slide peaked in early January and have come down steadily. They have leveled off at a relatively low level, and I do need to reflect that this is PCR positive cases. Not everybody who's had COVID. As we know, many people now are using rapid tests and are being able to self-diagnose in the community and take the measures they need without ending up having severe illness and ending up in hospital. So we have been following as well our hospitalizations, and trends over time again are slowly coming down and have been leveling off a little bit, but we need to look a little bit more in depth at who is being hospitalized in our communities across BC. As you know, we moved to reporting hospitalization as a census, so it's everybody who's in hospital with a positive COVID test, and it continues to be that about half of those people are people who are in hospital with an incidental test. So it's not because of COVID that they are in hospital. It is still important to acknowledge that they need to be treated differently in some ways because COVID requires other precautions in hospital. We continue to see, thankfully, a very low death rate. So when we look at who are the people who are more likely to end up in hospital, and are there measures that we can take to help mitigate and prevent them from having that severe illness, we can see over time that it is our elders and seniors who are more likely to have severe illness and end up in hospital, and we see that continues with people over age 80 through this Omicron wave also being more likely to have more severe disease, and that has leveled off and has a slight uptick in the last week. Also, when we look at this, we can see how younger people are less likely to end up in hospital, so at risk, and can we provide them with a booster dose that will prevent that from happening? And today we're announcing that that looking at this data, we are going to be offering a spring booster for elders and seniors in British Columbia as the people being most at risk. We know that the older we are, the sooner that antibodies will wane, and the less strong our cell-mediated, those memory cell responses will be. So an extra booster dose rate now will provide a rapid increase in antibodies, and we've seen that from data in other countries where this has been used, and will provide that spring protection as we're able to get back to more activities in the community. So it will be available to, we'll be providing it to residents of long-term care at any age and assisted living, and for community seniors 70 and over across the board in British Columbia, as well as for Indigenous people at age 55 and older. And the fourth dose will be at about 6 months from your first booster dose or the dose 3. In addition, we've always had a different program. We've recognized that there are a group of people who are what we call clinically extremely vulnerable. And we know that they needed 3 doses of vaccine to get the protection that most people have from 2. And several months ago, we also put in a booster dose program for that group of people, so a dose 4 at about 6 months. And right about now is when many people who are in that CEV group 1 and 2, the immune compromising conditions, will be receiving their dose 4 as well. So this is going to be a really important measure for us to boost the immunity in those most vulnerable to severe illness and hospitalization as we go into these spring months. Along with that, with this level of community immunity that we have now, we are in a position where we continue to make progress, removing some of the measures that are no longer necessary all the time. One of those is the BC vaccine card, which was very effective at supporting people to get vaccinated, but also during this highest risk period, being able to have these measures in place in those highest risk settings. So it is no longer required under order, so no longer a legal order, but we do know that many businesses are looking at their own clientele and their own people who go into theaters and movie theaters, and some will continue to require this. As well, businesses will transition from COVID safety plans to communicable disease plans. And these were the plans that got us through much of 2021, and we reinstated those COVID-specific safety plans early on in the Omicron wave when we still didn't understand exactly what the conditions were going to be with Omicron. So we're now going back to those safety plans, still being aware in every workplace of the risks and the measures that are important to be in place to reduce the risk to workers in all of those situations. Finally, we'll be removing the post-secondary residence vaccine requirement. We have seen that there are very high rates of immunization in young people, particularly young people who are living in residence in post-secondary institutions, and so this was not felt to be required anymore. Just to go back for a minute to the spring boosters, I wanted to reiterate how important it is for all of us to ensure that we are up to date with our vaccines, and that means now getting a booster dose. We are seeing a leveling off in transmission, but that doesn't mean our province is no longer vulnerable to new and potential variants that are coming in the future. It's important for us to address the risk we have now, but also to think ahead. We're still in a transition phase, and we're still in this pandemic, and we still have a lot of uncertainty of what's coming next. People who don't have the protection that vaccine gives are at the highest risk, no matter what your age. And more data shows us that the booster dose at all ages decreases transmission, doesn't eliminate it completely, but even with Omicron, even with the BA.2, it reduces that risk of infection across the board and provides, as we've noted, very strong protection against hospitalization, ICU, and death. So now is the time to get your booster. If you've had Omicron in the last few months, you can wait up to 3 months, but we know that the booster dose does give you longer and stronger lasting protection, even if you've had Omicron recently. I think it's important to recognize as well that we are transitioning from these broad societal orders where we needed all of these measures all of the time. But it's not all or nothing. We need to learn to live with COVID-19 better, to make sure that we continue our good habits that protect us, our family, and our community. I also want to say, and we've been talking about this on and off for the last number of weeks, but we will be transitioning from the daily numbers reporting to weekly reporting starting this Thursday, April 7th. What that means is that we will be able to automatically link data and have more in-depth and detailed, accurate reporting of numbers of the previous week to get people a better sense of what we expect to see and what the risk profile is. We have, as we've seen, especially during Omicron, when it was very challenging to keep up with the daily manual line lists, we see various swings on a day-to-day basis. So we now have an automated process that allows us to do it in a more accurate and timely way. As well, we'll be transitioning to a new way of reporting people who've died from COVID. And it's going to be looking at 30-day all-cause mortality in anybody who has had a COVID-positive test. So that means we will be overcounting people early on, because we know that it takes several days for the linkage to happen between our lab tests and vital statistics. But then as we get the cause of death data in from vital statistics, that will be updated on a rolling basis. And that gives us a more accurate picture of all cause impacts from COVID-19. I do want to just quickly update about the Regulated Health Professionals Order. I do want to also say that the changes in use of the BC vaccine card and this order have no bearing on the requirements that we continue to have for all healthcare professionals in our public healthcare system to be vaccinated. That requirement has been incredibly important in protecting our healthcare system through this wave, and is important for helping us make sure we're ready for what comes in the future. But we have been working with the 18 regulated health profession colleges to gather data on vaccine status of every registrant, and the deadline for this was March 31st, and the colleges are actively doing that right now. We have good data on most people, but they are continuing to follow up on individuals who may have been on vacation or maternity leave and other things. Our team is now actively compiling this aggregated vaccination data by profession, and I will be reporting that out by profession so people will have an understanding of the vaccination levels in different professions in the community and can make their own informed decisions about their own care based on that. We are also working with the colleges, and will be over the next few weeks and months, to put in place processes based on risk so that people will have informed consent about whether they want to receive a procedure or a healthcare service from a private practitioner who's vaccinated or not. I do want to say as well that we are working very hard to integrate all of our surveillance pieces. And although we report out on a regular basis on a number of things, we are following a number of other surveillance streams, including a population, what we call sentinel surveillance. We've had this in place for many years for influenza, and we're integrating COVID into that so that we can look at all of the serious respiratory illnesses that we have to deal with and manage in the future. So that includes things like influenza, COVID, RSV, and parainfluenza. We're looking at, we will be and continue to do facility-based monitoring of cases and outbreaks. We're expanding our systematic early warning signals through wastewater to areas outside of the Lower Mainland. This has proven to be a really helpful objective surveillance measure, so we'll be expanding it across the province and also expanding the number of pathogens that we can look for using this wastewater techniques that we've perfected over the last 2 years. We'll be continuing to do more frequent targeted serological surveillance. So that's looking for those antibodies in the blood that I've mentioned, doing it in a shorter time frame that helps us understand the transmission of the different respiratory viruses over time. And we'll be continuing with our whole genome sequencing, as we've seen how helpful it is in helping us understand the different transmission patterns of the different variants that are affecting people in British Columbia. As we progress forward through this phase of our pandemic, a transition phase, we are in a place where we can go from those mandated requirements to managing things with the good, managing our own health, looking at the good habits that help us protect ourselves, our family, and our communities. COVID-19 transmission continues, but at a much lower level and with a much higher level of community protection right now. But we know that that will wane over time, so we need to build these habits and these tools in that we have now into our future as well. These good habits include the importance of keeping up to date on our vaccination. And that means right now, a spring booster dose for our elders and seniors in long-term care and in the community. But we will be watching and looking at different variants that arise, what might our future be in terms of next respiratory season, late summer and spring and fall. It may be that we will recommend a booster dose for more people. It may be that we will need another booster dose for those who are most at risk. It means paying attention to how we are feeling and staying home if we're sick, using rapid tests to help us make those decisions about whether it is COVID that's causing our illness or not. It means wearing a mask when we choose, or if somebody asks you to, or if you're entering their home or their business. It's about also knowing our own comfort levels and respecting that of others. We need to pay attention to things like ventilation, about the things that help us, enable us to do this, like paid sick leave. There is no magic moment to lift restrictions, and there's no amount of delaying that will make it absolutely safe all the time. So it is something that we need to find this balance. And I believe as we're transitioning through this, we have the tools that we know work. We have vaccination. We have the things that we are getting used to being in the habit of doing, like staying away when we're sick, like wearing a mask when it's appropriate. This is our time to walk through this transition together. And I want to thank everybody across the province for doing their part for so long. It has been a most challenging time, and we are not through it yet. But your kindness and compassion has made the difference in so many ways. And we need to keep doing this together through this phase and as we get to the next phase in the spring and fall. Thank you very much.